Good day, everyone, and welcome to this scientific conference. I, Dr. Ibrahim, on behalf of other co-authors, will be presenting on the topic, a study of perpendicular smear practices among female nurses in a tertiary hospital in Gombe, northeast Nigeria. For the purpose of this presentation, I'll follow this outline: introduction, methods, results, and conclusion. By way of introduction, both the incidence and the burden of cervical cancer have been drastically reduced in the developed world due to regular practice of cervical cancer screening with pap smear. Unfortunately, disease is still the most common gynecological cancer in Africa and the second leading cause of cancer mortality in Nigeria after breast cancer. The aim of the study was to assess knowledge, attitude, practices of perpendicular smear among female nurses in a tertiary hospital in Gombe. A cross-sectional study was conducted among 91 female nurses in Federal Teaching Hospital who fulfilled the inclusion criteria. The data were analyzed at invariant and bivariate levels using SPSS version 23 with p-value of less than 0.05. Ethical clearance was obtained from Gombe State Ministry of Health Ethics Committee. Written informed consents were also obtained from the participants. The mean age of the respondents was 39 years with standard deviation of 7.3. The age group 25 to 34 years constitute 45.9% of the participants. Greater proportion of the respondents were married. About 54.9% of the female nurses knew that pap smear is a screening test for cervical cancer. The respondents had good attitude toward pap smear as a cervical cancer screening test. Only about 38.5% of the nurses have had pap smear done. Being married was found to have statistical significance association with knowledge of the pap smear. In conclusion, the study showed that the female nurses who should be an advocate of cervical cancer screening test to the society have poor practices toward the test despite their fair knowledge and good attitude of the screening test. Thank you for listening.